Hello, my name is Rachel Hines, and I'm an 8th grader at RGMS. This year, for my scenario, I decided to research speech therapy. I was mostly inspired by my sister, who is currently studying to become a speech therapist in graduate school at University of Tennessee. So I thought it'd be cool to learn about and kind of see what she's doing. Okay, so first thing I learned about different speech disorders. Some speech disorders include articulation disorders, fluency disorders, resonance disorders, receptive disorders, expressive disorders, cognitive communication disorders, dysarthria, and aphasia. Okay, first we have articulation disorders, and these types of disorders take place when you're not able to form the word sounds correctly, and kids with this disorder might drop, swap, or add different word sounds. Next is fluency disorders, which affects the flow, speed, and rhythm of your speech. And some fluency disorders are stuttering and cluttering. People with stuttering have trouble sounding some sounds out and could have speech that is blocked. Or they might repeat a word. People with cluttering speak very fast and they merge their words together. Resonance disorders. So this occurs whenever someone has a blockage of the regular airflow in nasal or oral cavities that changes the vibrations for their quality of their voice. And it could also occur if their velopharyngeal valve doesn't close the correct way, and it is often associated with cleft palate, neurological disorders, and swollen tonsils. Next is receptor disorders, and people with this disorder have trouble understanding and processing what other people are saying. So they could come off uninterested on what a person is saying, and they could have trouble following directions, and they could also have a limited vocabulary. Other language disorders, autism, hearing loss, or head injury could result in that disorder. Expressive disorders, this is when people have trouble expressing information. So if someone has this, they might have trouble forming accurate sentences, such as using the correct verb tense. And this is associated with developmental impairments, like Down syndrome and hearing loss. You could also get it from head trauma or a medical condition that you might have. Next is cognitive communication disorders. This occurs whenever a person has difficulty communicating because of an injury to the part of the brain that controls how you think. This results in memory issues, trouble problem solving, and difficulty speaking and listening. It is caused by biological problems like abnormal brain development, neurological conditions, brain injury, or stroke. Next, dysarthria. This disorder is when a person has slow or slurred speech because of a weakness or inability to control their muscles for speech. And it's mostly caused by nervous system disorders and conditions that cause facial paralysis and throat and tongue weaknesses. It can also be caused from MS, ALS, and a stroke. Next, we have aphasia, and it is an acquired communication disorder that affects people's ability to speak and also understand people. And it affects how a person is able to read and write. The most common cause of this is from a stroke or other brain injuries or disorders. Now, you might be wondering what goes on during speech therapy. So in speech therapy for children, it begins with an assessment from a speech-language pathologist who determines what communication disorder it is and how they need to treat it. It could be in a classroom, in a small group, or one-to-one. Depending on their disorder, age, and their needs. They interact by talking, playing, using books, or other objects, and language intervention so the child can stimulate language development. The SLP will also model the correct way to say sounds and syllables and give the patient some homework to do at home with the help of their parent. Speech therapy for adults. So speech therapy for adults also begins with an assessment to figure out what their needs are and what kind of treatment they need. The exercises for adults help with speech, language, and cognitive communication. They might also be retrained for swallowing if they have an injury or medical condition such as Parkinson's disease, or if they have oral cancer that has led for them to have difficulty swallowing. They have exercises that involve problem solving, memory, organization, and other activities that focus on improving their cognitive communication. They also do conversational tactics to help with social communication, breathing exercises, and exercises to make their oral muscles stronger. Okay, how long do you need speech therapy? Well, how long you need to continue speech therapy depends on your age, type and severity of your disorder, and how often you go to therapy, and if you have another underlying medical condition, and what your treatment for that medical condition is. When someone's speech disorder begins in their childhood, they might improve as they get older, or they might need to have long-term therapy into their adulthood. When the speech disorder is caused by a stroke or medical condition, it might get better with treatment and as their condition gets better. Okay, now how successful is speech therapy? This depends on, again, the disorder, age group, and when the person starts speech therapy. Speech therapy for young kids is most successful when they start at a young age and practice at home with a parent. Okay, so some skills worked on in speech therapy are strengthening their mouth, neck, and jaw muscles. They also work on making speech sounds clear, matching emotions with facial expressions, and understanding body language, and also answering questions and matching a picture to its meaning. They may also use speech apps on an iPad and modulating the tone of their voice. Some other alternative communication methods are sign language, picture exchange communication system, iPads, and speech output devices such as Dialogues. So this is everything that I researched for my project this year, and I hope you learned something new, and thank you for watching. Bye.